Hello, everyone. Welcome, welcome, welcome. Happy Saturday. Good morning, good afternoon, good evening, wherever you're tuning in from. Let's talk about breast cancer and relate it a little bit to mental health, as always. What is our health without mental health? Breast cancer and mental health are very closely interconnected as the emotional and psychological impacts of breast cancer diagnosis can be profound, affecting individuals and their families alike. From the moment of the diagnosis through treatment and even beyond, patients often experience a range of mental health challenges, including anxiety, depression, PTSD, and all that. We have some experts here today to talk about it, and please stay. The impacts of breast cancer to our mental health. I will start with you, Jessica. Can you please just give us a brief introduction of yourself?
Hi, thank you for having me as a guest. There's definitely validation in sharing my story. So, with that, my name is Jessica Whorton. I'm a 12-year breast cancer survivor, human resource professional, and proud mama to two beautiful daughters.
Nice to meet you. I'll go to Dr. Gwanmala. No, let me say that Gwanyama. I got it first now. Okay.
Hello, everyone. Thank you very much for having me. I'm Dr. Gwanyama Noella. I'm a medical doctor for over 6 years now, and I'm the founder of Talk Pregnancy with Dr. Noella. I'm so happy to be here.
And where are you located, please?
I'm presently in Cameroon.
Thank you for joining us. I'm so elated to be sharing this platform with you guys. Next is Denise.
Hi everyone, I'm called Dénise Mbako. I'm a mental health advocate and the founder of Give It a Meaning Again. I've been advocating for mental health for over 5 years now, following my personal experience.
Thank you. Your personal experience. I hope we get to hear that a little bit. Thank you. I'll start with you, Jessica. Can you share your personal journey as a breast cancer survivor and how it has shaped your perspective?
Sure. So, I was diagnosed at 33 with stage 3 invasive ductal carcinoma after having visible breast lumps for 9 months that my medical provider said did not feel like cancer and
Mhm.
said I was too young to have it. So, after an incredible amount of self advocacy, I finally got my diagnosis. With that, I had a profound shift in my perspective on life and work. As a 12-year survivor, the experience led me to a reevaluation of my priorities and values. And their studies have shown that this experience brings a heightened sense of resilience and emotional intelligence.
Mm.
As studies have shown that breast cancer survivors tend to develop greater levels of resilience and mood repair compared to those not faced with the disease. So, with that, my resilience has translated into a more empathetic and supportive approach in the workplace. And some of the ways that this has influenced my perspective includes a new appreciation for life, resilience and strength, empathy and compassion, especially for those going through similar experiences, a new work life balance where I really set my own priorities and values, and then purpose and meaning. It really defined my life and gave me a new, more purposeful meaning for me to go in. And so, my breast cancer experience has been profound, but it has definitely strengthened my character and made me the person that I am today. So, that is my background and my story. Yes.
Jessica, when you got that diagnosis, I mean, we can talk about it now. We can share your victory, but the day you got that diagnosis. Can you walk us a little bit through that?
Sure. So I was at my medical provider's office for, they were running late. So I was sitting in the office and I had to think about what was happening to get my biopsy results, right? So I'm in the waiting room for over an hour. They finally call me back. They say, Jessica, your right breast does not have cancer. However, your left breast does. And at that moment, my entire life stopped. That's not what I was expecting at all to hear at 33. In the height of my career, mother of two young daughters,
Oh,
it was life altering. And to be honest, I was in such a state of shock that I wasn't going to do anything about it. I was just going to continue working and pretend like nothing was happening in my life. If it wasn't for my supportive husband, who talked me into getting the medical help that I needed, I don't think that I would be here, honestly, without that support. But it was absolutely life changing and devastating in many ways. I
were you
felt,
were you alone at the doctor's office?
yes, I was alone at the doctor's office. I wasn't planning on getting that kind of response. I would have brought somebody with me.
What did they say? Because now it's almost like, "Hi, Miss Jessica, how are you doing? Did you come alone? Do you want to sit down? Do you need water to drink?" They start kind of like preparing your mind. You're like, "What's going on? Do you have someone to drive you home?" Was that the approach?
Well, my approach was I was just going to go get my results and then go back to work.
Mhm.
And it was life changing. And I actually had to call my husband to come pick me up from
Absolutely.
my appointment. I wasn't able to drive at that time. I was too emotional and overwhelmed with the situation.
Right.
I had been told for so long that it wasn't cancer, didn't feel like cancer. I was too young for cancer. And then, oh my gosh, I do have cancer.
Because up until today, that still looks like a death sentence. And it doesn't matter how strong you are, even when during the process you have some inklings like, it may be this, it may be that. Even when just going for mammogram, like annual mammogram, at the back of your head, we still have that little fear like, what if? It still feels like a death sentence. At that time, did you feel like your world will end?
Yeah, I did not see much hope in my life at that point. Knowing what I was going to have to go through treatment wise, and then having gone through several treatment related complications that left me a convalescent for many years afterwards. Yes, I was in a state of despair for a very long time.
I'm
And
not
it
gonna lie
wasn't,
to you. When I'm going for my mammogram, I'm calling everybody. Pray for me. I'm calling my mother. Then I'll be on the phone with my sister until I get there.
absolutely whatever kind of
I
support
mean,
you
it's
can
just
get.
mammogram, and it's not like it is mammogram. I'm calling my. I'll start texting them the day before. Hey, tomorrow I'm going for my mammogram. I'm going.
Yeah, there's that scan anxiety that you can get, that everybody that fears, any woman that's going for a mammogram or men who have symptoms of breast cancer. It's very scary.
It is scary. And let me go to you, Miss Denise, as a mental health advocate. How do you see the connection between breast cancer and mental health? How is it being addressed in healthcare settings?
Okay, thank you very much for that. I'll speak on the little I know
Mhm.
based on the few people I've come across that have breast cancer.
Mhm.
Firstly, I want to appreciate the entire healthcare system, the doctor, the nurses, for the great job they are doing. Because it's not easy breaking down this news to people every day, right? This is a life altering disease that before you open your mouth to tell somebody, it takes a lot from you.
Mhm.
But then I would say that there's still so much work that we need to do
Mhm.
based on how we give patients their results. Let's
Yeah.
take Miss Jessica for instance, Madam Jessica for instance, how her result was given to her, right? It wasn't even like Do you have somebody around, just like what you said, just to make sure that that's very important? Because how do you expect me to hear that, oh, I have breast cancer?
Yeah.
I'm a woman, like part of me is having breast. Right? Like what part of the things that identify me as a woman is having breast, and the whole thought of, okay, my breast might get cut off, this might happen, that might happen, and then you expect me to go home alone. You did not even put those things in check. It's very important.
Very.
Also, when I'm going through treatment, how is the healthcare supporting my mental health? It's a physical illness, yes, but mental health scars are invisible scars, and I believe that as practitioners, that's like the first thing they need to
Yeah.
know, right? This is physical, but the bulk of the work is mental.
Yes.
All of these is just, they say we die in our minds first before even our bodies, right?
Yes.
Yeah, so everything should be on how do we address the mental health of this patient who has breast cancer, and
Yes.
not how do we address the breast cancer that this patient has and forget about her mental health.
Yes. Thank
Yes.
you.
Yes. Thank you.
Yeah.
And yes, even though they are invisible scars, they are very deep. They go very deep.
Yeah,
And sometimes, even when the physical healing has taken place, the, the mental health healing is not guaranteed that it has
that's
taken
true.
place or it will
Yes.
take place.
Yeah,
Because even though your labs are showing different things, mentally, emotionally, there are still many struggles going on. Is it gonna come back? By the time you're going for another scan, is it there? Do I need to change my will? How long do I need to live? Do I still pursue this career? Will I be able to? It is very, very, very challenging. Yes, thank you. There may be invisible scars, but the reality is that as invisible as they may be, they will affect everything visible that someone can see. They will
yeah.
affect everything that someone can see. Dr. Gwanyama, please, as the founder of Talk Pregnancy with Dr. Noella, how do you integrate discussions of breast cancer awareness into conversations about maternal health and pregnancy? I know when you deal with maternal health, breast is part of it. How do you integrate all that?
Thank you very much again for having me on this platform. It's really such an honor. And as the founder of Talk Pregnancy with Dr. Nuela, what with Talk Pregnancy with Dr. Nuela, we seek to improve the health of women, children, and adolescents. So we actually do that through advocacy,
Yeah.
carrying out sensitization campaign, and definitely we don't miss out on sensitization campaigns on breast cancer as well.
Mhm.
So we include, especially during the month of October, which is the Breast Cancer Awareness Month, it's something that has to be spoken about
Yes.
because many young people now, we know most of the times we talk about breast cancer at the age from 48, from 45, 50. That's when some people really start thinking like, oh, that's when I can have breast cancer and that's the time I can screen for breast cancer.
Right.
But now we are seeing that things are changing. People are becoming diagnosed at an early age,
Yes.
and time we need to bring out this advocacy and sensitize more patients about breast cancer. So what we usually do is we hold webinars, we carry out online sensitizations, we put out posters on the various risk factors, especially the modifiable risk factors. There are a lot of things we have to do. And one thing they don't know is that these things which we do at our younger age exposes us in the future to this
Absolutely.
cancer. Yes.
Yes.
And this is where we need to make those changes. And that's where we focus on. We understand that there are the non modifiable risk factors that you can't do anything about that. Definitely, we settle and we concentrate more on the modifiable risk factors.
Mhm.
That's why we make sure they know that. what can they do? Because when we talk about breast cancer screening, we know the main test, which is the mammography,
Mhm.
and the mammography normally is effective after 40 years. We don't deny that.
Mhm.
And just because of the breast mass, the density of the breast, so after 40, the breast density is reduced. So, but they forget to know that there is something they can do at an early age to prevent something in the future. So that's what we focus on. We focus on that advocacy. And lastly, we make sure that at the age of that's under 40, they practice what we call self breast examination.
Yes.
We do, yeah, their monthly self breast examination. And maybe if they find any mass, they know that they have to visit their gynecologist. And maybe if there's maybe the after some months, or maybe like in after 6 months, you can do like a clinical checkup where you just go to the hospital and a doctor or a health personnel does the checkup, not necessarily you, because sometimes you might miss out on some certain aspects.
Absolutely.
So we focus on that advocacy.
I'm glad you
Thank you.
said focusing on advocacy and even what we teach before 40 or at a younger age, it carries out to the latter years.
Yeah,
Have you noticed that most of the time now with breast cancer, many people do not wait for mammogram to tell them. If you do your breast exams regularly, if you do self examinations and all that, it has been noticed also that many people are able to go to be the one calling their
yeah,
doctors and say, hey, I feel something wrong somewhere. It's
absolutely.
not painful, it's not doing this, but I still feel something there. Let's check. And thank you for all the awareness efforts, because if not, we can assume that, oh, it's 2024, people know, some people do not know. They think
Absolutely.
that, oh, I've been doing this for how many years? I've been spreading the news for how many years? People already know about it. No. Maybe that one more day that you create that awareness, it will lead to more people knowing what is going on. It will save one life. Somebody may hear, a male may hear, a female may hear, and know somebody that they can reach out to. And I want to stay with you, Dr. Noella. What are the unique challenges pregnant women with breast cancer face, both physically and emotional? I'm sure you've had some pregnant women who have breast cancer. Oh, oh, there she goes.
Yeah.
Yeah, what are some unique challenges that some pregnant women that you meet face? Those who have breast cancer.
Yeah. So when it comes to breast cancer, we have seen, especially with pregnancy, that's what we call gestational breast cancer. This is something which the percentage is actually about 13 to 35% out of 100,000 women
Okay.
seen. Yeah, or live births, that's pregnant women. Yeah, so the percentage is low to really see that. And most of the statistics which have been shown, there's not really like a prospective study done, or the maybe, yeah, on pregnancy and cancer. Most of the cases which have been reported are retrospective and just case report cases. So really getting to see, most at times we see the people who have maybe like delivered, and yeah, even though with the gestational or pregnancy, it's usually like at least 1 year postpartum.
Mm-hmm.
But one thing that we see, especially the main challenge,
Okay.
is keeping their pregnancy and cure of the pregnancy. Now, that's always the main challenge. Do you terminate the pregnancy to maybe to give her a cure, or you continue with the pregnancy? But statistics have shown that it doesn't really change the mortality rate of the woman if the baby is terminated. So
Mm-hmm.
most of the times they still continue with the treatment with the pregnancy. most at times. It's most they don't really advise you to maybe terminate the pregnancy before doing that, and that's always the reason why, as a woman, the first thing is, if you're pregnant, the first thing you think about is your baby.
Baby.
Times they even want to, like, please save my baby and leave me. Maybe I could don't touch my baby, but maybe with me, just leave me, let me carry my baby to term, because they feel that with the therapy is going to affect the baby, or maybe with the follow-ups and all that is going to affect the baby. So I think that that's the first emotional challenge they face with
And that's a
the
very difficult one because
very
you're,
difficult.
yeah, emotionally, mentally, that's a very difficult one. You're in a position where pregnancy alone sometimes can be very challenging. Then you're not just going through the physical and emotional challenges of
Exactly.
pregnancy, but you're going through trying to make a decision. Do I terminate this pregnancy and save my life? Because that is the question. Do I try to save my life? Do I save the baby's life? Or going through saving both of our lives, how is this going to be possible? So
Yeah.
that oh my god, I would never want to be in that kind of position, and I don't wish it for anybody. Is there any physical challenge that you guys see as well, Dr. Noella?
Yeah, most of the physical challenge comes in with maybe if they have to go like for a surgery, and at that time maybe your one breast, for example, is amputated, and you have now to start breastfeeding your baby. You start thinking of, oh, this other breast is not there, and those are some physical challenges. And definitely with cancer, it comes with its own, maybe it weighs you down physically. You lost a lot of weight, and maybe you become weak, you're not able to do some certain kind of things, especially with some treatments that are given to you as well. So those can actually break you down, and you're not able to carry out your normal physical activities as before. So that's really one of the main physical challenge they have.
Right. Let me come to Jessica. You were not pregnant when you were diagnosed with cancer, were you?
No, no, no.
Thank
And
God.
I cannot imagine, I can't imagine that kind of struggle either. But no.
Thank God. We want to really, really take time to celebrate your victory because it was not just physical victory, and I know the emotional challenges still persist. There are times where it feels real. There are times where there are a lot of doubts and uncertainty because, like Dr. Noella said, it's not everything that is beyond your control. You have those
Right.
risk factors that are there, whether you like it or not. Yes, we can only control certain things to an extent. But as an HR professional, how do you think workplace can better support employees going through cancer treatment or recovery? Being someone who has been in that situation, being someone who wore those shoes, and now you are acting as an HR role. How do you think workplaces are we giving them enough support emotionally, physically, still making sure that they don't lose their roles at work? Sometimes they may, but how do you think workplace can better support employees going through all this?
Sure. That's a great question. Thank you so much for bringing that up. As an HR professional, creating a supportive environment for employees undergoing cancer treatment or recovery is absolutely essential. Some of the ways that workplaces can help accommodate their employees that are facing cancer treatment would be through flexible work arrangements.
Uh-huh.
So, allowing flexible hours,
Mm-hmm.
remote work options, or even part time options.
Mm-hmm.
Also, having access to those resources, uh, providing information on what the health benefits are that they have available
Yeah.
to them, what counseling resources they have available to them, and what support groups are available
Because
in the
sometimes they
community.
don't know. Sometimes they don't
Absolutely.
know that they have those benefits. And you know how they always say it is the patient that looks for the doctor. If you're not in that shoe, you don't start asking questions like, nobody, I mean, well, maybe few people sit and go to a job and be like, if I have cancer, does this job do this? Those are the things that we don't even want to think of, but those are realities. And I know that it's a lot of work for HR. So are you when employees are signing up for their benefits, do you go through those with them?
Absolutely. I am completely upfront with all of the benefits that my employees have.
Mm-hmm.
I mean, I think it's crucial to know what is available to you so that way you can utilize those resources.
Mm-hmm.
So, yes. And even now, a lot of workplaces are offering cancer survivorship benefits in addition to regular health insurance. So, that's really neat that workplaces are going in that direction as well. Also offering emotional and mental health support services. So, encouraging open communication and offering those mental health resources can really help the employees
Yes.
with the emotional challenges of this kind of diagnosis.
Absolutely. You said something again. They may work remotely, they may have that flexibility. Like today, I'm so nauseous. I just took chemo. I don't have the physical strength to go to a workplace, but maybe if I stay home, rest my body, don't get caught up into traffic, I may be able to sit on that computer and do some work. Those flexible little things that workplace do for people is very important, or they are very important. And for people like you, Jessica, thank you, because we know that we don't just ask and receive. It takes HR to advocate for the employees,
Absolutely.
especially if they are in healthcare. It's always like, oh, they are sick, we need someone to do this, we need, it takes HR to say, can that person do this from this angle? Can that person rest? Can we extend their benefits? Can we extend their hours to be more flexible? Can we give them more time off? They are going through this treatment. We do not have to terminate them. Can we give them a part time option and still give them some benefits? It takes HR to really advocate for employees in that moment. So, thank you so much for that. Miss Denise, I want to ask you this: what are the common mental health challenges that breast cancer patients face during and after treatment? But we cannot hear you. Let me see.
Oh, sorry, my mic was muted.
Okay.
So I said, thank you very much for that question. I would share this based on somebody I'm currently following right now. She used to be a colleague of mine. I don't want to call her name, not to sure
Of
she's
course not,
comfortable.
please.
Yeah. So she's sharing her journey on breast cancer on Facebook, on her different social media handles. And every time I read, here are the few things I pick out from her. Some days she's very hopeful. She's showing all sides of I'm resilient, I can fight this, because she's equally a youth leader in Cameroon. Other days when she writes, you pick out uncertainty about how the future looks like for her. That's just now she's in the face of she has been diagnosed and she's going through treatment. It's There's so much uncertainty when she writes and shares her journey with us on Facebook. Other times you realize that the slightest thing gives her these panic attacks, this anxiety, the way she responds to people when they comment on her posts. And there are times when she comes online, she shares with us how her night was, how the night was for her. When we are saying my night was good, she's sharing how painful it was for her, how lonely it was. There's this common parlance we say, I define network for night when I sleep. Yeah, she's sharing how painful it was, how
Oh,
painful her night is. Sometimes she's moving up and down, struggling. Where which position can she take just to find rest? How should she lay her bag? And now she's looking at, oh my God, my size, I'm losing weight, or how are people seeing me? What are people saying about me? Her self esteem sometimes. Only from her write ups you realize that it's slowly dropping. When you check out her pictures, there's some pictures where she doesn't really smile much. Other pictures, you see so much life in her. I think it's a roller coaster.
It
So
is a
today,
roller coaster.
today I can't
yeah,
even.
yeah.
tomorrow I can do this. Like, there is so much to life, right? You have to give yourself that positive affirmation. If there is life, there's hope. I can do this. And then the pain now sets in, and
Yeah.
it's, how long do I even have to live? I've seen people die from this.
Right. And
And
maybe
now
still you're full of hope, you're jumpy, I can beat this, your resilience, your emotions, you're like, I'm powerful. You fill yourself with affirmations and everything. We are human, right? You go see the
yeah,
doctor, they do labs, they're like, oh, your labs are not looking too good. Yeah, it's difficult to come out and still be smiling, and it cannot be a linear equation. There are
never.
moments up and down. There
Yeah.
are ups and
Absolutely.
and that will hit
Yeah,
anybody. I don't care how strong you are.
Yeah.
There will be
Sure.
those
Sure.
moments where you sit and say, God, how do I go through this and still stand? You talk about self-image, self-esteem. Sometimes
yeah,
they have to amputate that breast. Sometimes they,
Yeah.
yeah. And you just said it in the beginning. Part of being a woman is part of having these little girls. And, and sometimes that's part of your identity and it's no longer. Sometimes it
Absolutely.
brings self-esteem issues because of the body image. And not only
yes,
that, with chemotherapy, we know how it can scar you. You are losing everything, your hair, your cognition, a lot of things. Today you wake up hopeful. So it is not the same. And the journey is not the same for everybody. I want to
yeah,
call on everybody to treat it with a lot of reverence, a lot of respect, a lot of emotional sensitivity,
Yeah.
that you somebody you know who is going through that, be there for them, even if
Yes.
it's just by being quiet, just to give them that space to vent. Be there for them and help however way you can. It is
yeah,
very important because it looks like that person has just been handed a death sentence. And they may be in those places where you said, oh, I find network for night when I sleep, I'm looking for network. They may that person may not be in places like America where you have 24/7 help, where you can always call a number and speak with somebody and get revamped and get refueled and put gas in your mind to keep you going. They may be in those places where all that they can get is that phone call, or all they can get is when they go see their medical practitioner and they said, I'm sorry, do you need extra help? And sometimes there is no extra help they can give you other than, I'm sorry you're going through this. The extra help is their community, is their friends, is their family. If you know anyone going through that journey, please respect their space. At the same time, be there for them. Know what they need. You can ask them direct questions. How do I help you? How can I help? It may be that day that they are so sick, they don't even have the strength to make a meal. Just giving them a meal that day may be helpful. You may just be a silent listener. Just listen. Maybe that's the help they need at that time. Maybe they need a ride to the hospital. Maybe that's how you can help them. Maybe one call. How are you doing today? And they
Yes.
may be protruding something. It doesn't mean they may be protruding all this energy, all this hope, all this resilience behind when everything is silent, when everything is calm, when everyone is sleeping. You may be that network that they need because they are human. They're still going through that moment. And I want to stay with you, Denise. Does your company support individuals in coping with the emotional tolls that they go through? I know you said you people are also in America. I would like to get acquainted with that more. But do you guys support people who are going through this emotionally?
well, we've never really worked with anybody who is going through who has breast cancer.
Hmm.
Yeah, we've never really come across somebody like that. But definitely, if we should ever come across somebody like this, then just know that The same way we are giving everybody a meaning again, your case is never going to be different with us. We are pouring out our hearts, our passion, everything, just to see that even if you don't have people with you have Gima with you.
Yes.
Mhm.
Beautiful.
Yes.
Beautiful.
Yes. Yes.
Thank you.
Yes. Yes. And even if some people don't use the support that they have, just knowing that they have that
Yeah.
support means a
Yes.
lot.
Mhm.
Just
Yeah.
knowing that they are not going through that alone, it means a lot. I want to come to Dr. Noella. How do you think healthcare providers can improve the support offered to women facing both the breast cancer diagnosis and the pregnancy?
Yeah, I think that's a really good question and tricky at one at that. One thing I would like to even start right from the beginning
Right.
because, like Jessica was saying, from the maybe before they tell you about your diagnosis, we
Yes.
should be able to have experts who are
Yes.
able to tell you about that.
Mhm.
Because there's some, when you're trained as a medical doctor, yeah, you're taught about ethics and counseling, but not in that, in not in depth knowledge on that.
Yeah.
Maybe like giving out maybe the real counseling. So if we can start from there, even breaking the news, that's the beginning. Because you can just break the news to someone at that time and the person just collapses and dies.
And
And that's
then,
all.
oh, yep.
Yeah. So if we can start first from that place, the maybe giving out the information or the diagnosis to the patient, that's the first thing. Then we know, like in Cameroon now, the maybe like mental health experts are not really there, and mental health is really an issue now, and it's really rising,
Thank
and
God.
many people are getting now into mental health. So if we can train more people on mental health, clinical psychologists who are able to manage these patients, that's a next step. That's the second step. Now we go to, it's important to involve families. We see how the families get in. They should try in a way, maybe like with the mental health specialist and maybe clinical psychologists, see each on each patient to see how they can include their family members,
Right.
make them part of the journey. It's very, very important. That's the
Yes.
highest supportive system they need at that moment.
Right.
Now we need to ensure a pathway for adequate follow up, adequate and continued follow up, because there's this loss to follow up cases. People go maybe when giving up like the next time their next appointment and they don't come. What do they do? So we need to come up with some strict measures
Yeah.
and how to follow up patients. Those who don't come, we know we do it, but if we can make it like a systematic way, in such a way that once you miss this, there is a way to follow up and ensure that they are fine.
Mm-hmm.
If we ensure those aspects, then lastly, provide more treatment options. Seriously, in Cameroon, the treatment options are limited. Even if they are available, accessibility is also a problem. So if we can make more treatment options and maybe even decentralize it, because it's usually practically centralized in most of like the capital city in Yaoundé and in the economic capital that's in Douala. Most of the radiotherapy we want to see, once you start seeing people in the communities and you start sending them right to the capital, they just get discouraged. So
And sometimes
once
they even have connections in those areas. They don't
exactly,
have
exactly.
nobody. Mm-hmm.
You don't know anyone, and before you want to go there and see the doctor, you have to do some other tests, and it just gets overwhelmed. And at the end, they turn and go back and like, well, whatever happens. So it's very important to do the structures right from the diagnosis and maybe treatment and then follow up. So
I
I
like
think
the
if
way you said
this,
from, yeah, from diagnosis. I'll
yeah,
I'll Jessica, I want to share with you one that I know how they related it to them. You know how when you fill papers at work, who is your responsible party? Do you allow us to tell them something? We always sign those agreements. Yeah, in America, this is what happened. Who is your responsible party? In case of anything, who should we call? Are you willing for us to share information? They do all that. You sign, sign, sign. So for somebody, this is how that person was addressed. They called her husband. The hospital called her husband and said, "We got the result of your wife's thing. She doesn't know yet. We haven't told her yet. But the office is going to call her and schedule an appointment this day at this time. Please, it will be nice for you to come with her. If you know that you will be able to tell her in a safe environment, fine. If not, bring her to us and we will do the professional way to tell her." And not only that, they contacted the hospital's counselor or mental health provider to be there at that moment. Not only that, the wife's best friend for how many years, the husband contacted her as well. And
Oh,
this is
wow.
how, when the husband was told, of course, he behaved like he was dying himself. The hospital had to call him back, like, "Are you okay, sir? Are you okay?" And things like that. When he gathered himself, he did not tell his wife. Man, he's strong. He was able to keep it. 2 days later, he he took care of the wife. Is like, "You're not going to the work today?" He's like, "Oh no, this. I just want us to spend time together." Oh, he acted like something just came up. He left the house, came back, be like, "Oh, your car is not good. You know what? I'll take you to your appointment. Then when I drop you there, I'll go do this with the car, with my whatever." The woman had no clue. When he dropped her in the hospital, he's like, "You know what? I can just come with you." He made like he was on the phone with somebody and behave as if, oh, whatever he wanted to do, he can do it later. He's like, "Let's just go. This hospital every day that you come even now, let's just go. I used to come here when you were pregnant. I've never been here. Who is the doctor? Oh, I would love to see that doctor again." The wife had no clue. And while they were going, the wife's best friend was already in there because he was texting the husband. The husband had no clue. He's like, they're like, "Oh, what are you doing here?" This one too is like, "What are you doing here?" It's
Oh,
like,
man.
"Oh, this is," they are just talking before they know. The doctor just came and met them in the hallway and be like, "Oh," he's like, "Hi, doctor." The doctor is like, "What are you doing here?" The wife said, "Oh, the nurse told me that I have an appointment today." The doctor is like, "Oh, okay, that's good." Before you know, they were all in one room. They did not even go to a doctor's office. It was like a little conference room. They were all just sitting there like the waiting area. When the wife saw everybody like with a counselor, that's when the wife was like, was they're like, "Man, we are so sorry. These are your results." And I'm getting emotional about it.
Absolutely.
And she was at a safe place with a safe environment. She could cry. She could leach out all the feelings that she was feeling. She could be vulnerable at that time.
Right.
She could do whatever she wanted to do at that moment. She was at a safe place. She sat on the floor. Everybody sat on the floor. And the way her appointment was made, it was in a way that her doctor was not rushing to the next patient. They gave her that time. The counselor was there. Oncologist was there. It was all planned so well. By the time she got home, her mother was home. She was not alone. The kids came back from school. They had all this little pink stuff for her. The husband planned this.
I know. This is so moving.
It's not like, "Ma'am, sorry, you have breast cancer. This is the next step. We want you to go do this. We want you to start chemotherapy. These are your options." Just no. This is a life altering thing you're telling somebody. The approach, The way you put it on the plate and present it to them matters. It shows that you care. And
Yes.
from that moment, that patient knows that they are not alone. From that moment, that patient know that going through this, I have the backup, I have the support. These people took their time to tell me, I want to take my time to go through this. It shows that there is hope. It shows positivity. It shows potential of healing because that's what you fed that patient. So the approach matters. Healthcare providers, let us beware how we break this alarming news to our patients. It's not take peanut butter and eat. Oh, you're allergic to it. Is not that. It is a heavy weight to carry. Please
Yes.
let us, the approach matters a whole lot. I want to ask you, Jessica, what role did emotional resilience play in your survivorship?
Sure. Well, that's another great question. Thank you for asking that. So it plays a critical role in survivorship. Building resilience involves developing emotional clarity and the ability to repair negative moods, which are key factors in enhancing psychological well-being after a cancer diagnosis. Some of the techniques
Resilience,
that I use.
resilience is one of my best words.
Oh, yes.
Resilience is one of my best words in everything, emotional, mentally, physical. Resilience is like, okay, you get up some morning. It's sometimes it's not even through an outside thing, but it's in you, it's for you to build it up. So resilience is
Absolutely.
one of my best, and to be emotionally resilient going through breast cancer, it was not just a physical fight for you. So I just want to thank you for sharing this. And it doesn't mean that today you're resilient, tomorrow you're resilient at the same level. So thank you. And I know that it played some role deeper than you can even explain. And through that resilience, were you able to balance your work life?
Um, Had I not had the treatment related complications, I feel like I would have had a better grasp at the work life balance. I had gotten so ill, I was unable to work at all. And so there was no work life balance. It was treatment was
Yeah.
my life at that point. And so there was, different coping skills though that I used to increase my resilience.
Yeah.
For example, meditation, regular physical activity like yoga. Writing and blogging has been a huge source of inspiration and validation for me in my story and
Yeah.
building my resilience.
Yeah.
Also, engaging in support networks
Mm-hmm.
and volunteering, giving back to the cancer community is
Yes.
very, very rewarding and
Yeah.
can definitely build that resilience.
Wow. Giving back. Like, this is what I received. Let me give back. And
Yeah,
sometimes you can give back what you did not receive because you are in a better place to know what to give back. Thank you.
absolutely. Yeah.
Yeah. Thank you for that. What advice would you give someone who has just been recently diagnosed with breast cancer, especially regarding mental and emotional well-being? Like they are telling someone that you have stage 4 breast cancer. What what are you going to tell them when they are looking like I'm going to die very soon?
Sure. So seeking support is very important. Engaging with mental health providers, support groups, maintaining a routine, having some sense of control in your life, really, helps balance that and control treatment and normalcy. Planning ahead, so anticipating potential challenges and
Yeah.
arranging for necessary resources in advance, and then asking for help. Asking for help is a sign of courage. It is not a sign of weakness.
No. No.
So that, if I
So,
can really highlight anything, it's, to seek out support when things seem really overwhelming. It's
Yeah.
okay. It's okay to put aside your
Nobody has it all 100%.
exactly.
Nobody has it all 100%. Ask for help. Sometimes you did not receive the help because you did not ask for help.
Right.
Yeah,
Right.
Yeah.
Exactly.
yeah. Sometimes somebody wants to help, but they don't know how to. They don't know if you even receive the help. They don't know if it is what you need. And it may just be something that you need. Ask for help. Ms. Denise, can you share any personal or community stories that maybe you shared already? I think you shared one already. But the importance of mental health support in the breast cancer journey.
Okay. Coming to this, it's stories. Telling stories is literally the backbone of everything to me. I have friends to cancer, not breast cancer, and I see them in two different lights. Makes me to know that in as much as we say that breast cancer or cancer is a life altering disease, it's not only to the person standing in front of you. It has to do with their children, if they have. It has to do with siblings. In fact, the information you're giving this one person, which is changing their life now, is changing the 10 other people you're not thinking
Absolutely.
about.
Yes.
Absolutely.
And in as much as a community, we have to look who is who is right now. The people who are
Your,
while we are
your
checking
son
the
in and out.
has the disease. Can you get me well?
No, your sound is going in and out.
Network
It's
is breaking.
breaking. It's breaking.
Well, I think while we are waiting for your sound, there is an
Okay,
audience
now.
question. Yeah, let's see. I think we can get you now. There's an audience question to you,
Oh,
Jessica, saying what was the
okay.
most helpful support you received during your journey? And by the way, thank you for our audience for watching. Thank you with all your feedbacks. We appreciate you.
Yeah.
Yeah, we appreciate you all. I think this is a good team. I hope we have another session with just this team. May not be about breast cancer, something. Yes. But Jessica, what was the most helpful support you received during your journey?
Honestly, just having somebody listen to my story and validate what I was going through. That
No.
was the most support that I, just listening with
Hey.
an empathetic ear is what I like to call it.
Right.
With a generous heart and a compassion for somebody, and just being there. And even if it's just silence and you don't know what to say to them, you're there with them. You're bearing witness to what they're going through in their life. And that is by leaps and bounds the most support that I
Right.
received. I mean, and that was so helpful to me.
Mm-hmm.
My family really rallied against me. I had community support. It really takes a village to recover from breast cancer or any kind of cancer
Absolutely.
or any major illness,
Yes.
you
Absolutely.
know. And so
Absolutely.
in that community, there's definitely that sense of,
Yeah, thank you so much for sharing that personal.
sure.
Mr. Days, yeah, you were still wrapping up. It doesn't affect just the individual, it affects their whole family. It affects their friend network. Because everybody starts
Exactly.
shaping themselves like,
Yeah.
what do I ask her that will not irritate her today?
Mm.
Maybe I can say good morning, and the answer is that I don't have a good morning. How do I be there for her? How do
Yeah.
I show enough support? How do I listen?
And
Go ahead, Miss Denise.
and and this
Oh.
fear of, if this is happening to my mom, it happened to me too.
Mm-hmm. Wow. Wow.
Yes, yes, yes.
Exactly.
The risk factors, the risk factors as a female or as a male. My mom
Yeah.
had cancer.
Yeah.
Yeah, and that
Well, it
is
happened to me too. And as a community, we need to look at God. This is going through so much, or this man is going through so much. This person may die. How are they handling it? How about we look at with the same way we looked at them when they had cancer, or they had cancer of the breast, right? There's this hope if somebody looks at you and says, "Hey, hey, Madam Noel, how are you?" Instead of saying, "Hi,
Yeah.
hi, Noella. So how was
Mm,
the
mm,
night? Hope you
yeah.
slept." There is pity. Give
Yeah.
the pity.
there's
They don't
pity.
need it.
Yeah,
Treat.
and sometimes your
Yeah,
friends cannot even celebrate
you can
themselves.
support energy.
Mm-hmm.
Exactly.
Yeah.
Just the way you ask somebody how are you doing, help them feel like, oh
Oh,
wow, it means I'm dealing with this well. Like, I look
Right.
okay
yeah.
because there's
Yeah.
so much already. And the way you approach them, it's not making them feel like, okay, I'm dying or I look different. Okay, so how are you
Depressed.
doing?
Right.
The
I think it's very
that
dicey.
community,
Your
because where we live affects us.
your sound. We are still. I don't know
Your
if it's.
sound is
You
still
guys hear
Is it
that?
breaking.
Your sound is breaking so bad. We cannot get you. Yeah, your sound is breaking so. And I have seen cases where
Oh my god.
friends cannot even celebrate themselves because another friend is going through something.
Exactly.
Yeah, because how can I go and celebrate this when my friend is going? It will look like I am not supportive enough.
Supportive.
I had one very dear friend, dear sister of mine. She was going through it. She passed. She didn't make it. It was not breast cancer. It was another kind of cancer. The last day I saw her, she was tired. She was in so much pain, and I was encouraging her, take your pain medication. You cannot she's like, it's going to make me sleepy. I said, then sleep, rest your body and think, sleep so that you can wake up being refreshed and think better. And she said, what if I sleep and I do not wake up? Those were the last words she said, what if I sleep and I do not wake up? That took me to another level. I
Yeah.
did not know I was so strong. I did not shed one tear. I just kept encouraging her, like, show me over. What are the doctors saying? Things like that. When I left her house, she lives like 45 minutes from me. When I left her house, I immediately called my husband on the phone. I cried until I got home. What if I sleep and I do not wake up? We do not understand sometimes the depth of what people go through.
Go through.
And sometimes, even when I
Yeah.
don't see her, I'll just call her, she'll pick up the phone. We'll be on the phone for 5 minutes, nobody is talking.
Wow.
Nobody is talking.
Wow.
Mhm. But she knows that I'm there. And
Right.
sometimes she just doesn't want to cry. Sometimes and sometimes I'm not even asking her anything. Then sometimes she'll say, boss lady. She used to call me boss lady. I,
Oh,
I would say, yeah. She said, that food you even brought, sir, you know that's the only thing I've eaten. Now we talk about different things. I gave her the space to talk about whatever she wanted to talk about.
that's so
Yeah.
perfect. That is so
Wow.
perfect.
Let's talk about food.
Wow.
Let's talk about food. You want to talk about children? Let's talk. I gave her the space.
Wow.
Sometimes she'll drive me. She'll be like, boss lady, your patients are waiting for you. I say, you are more important. You know that.
Oh, wow.
And I always wanted to speak with her or call her at a moment that I am not saying, okay, let me rush and do this.
Mm-hmm. Mm-hmm.
That way,
Mm-hmm.
even if she's quiet for 5 minutes,
Yeah.
she still know that she has another 5 minutes to talk.
Yeah.
Right.
Yeah.
It is not easy. we have to approach it with care. And you have to learn to match their energy. She may also, we keep saying she because it's mostly with women that we see breast cancer. She may not be stopping you to live your own life, but if it's that's somebody who means something to you, you want to match what they are going through with your own activity.
Sure, sure.
She doesn't have to be in the hospital with no hair, admitted, throwing up, dying. And if she's scrolling through social media, the first thing you see, she still is you celebrating life like she doesn't matter.
Yeah.
You want to respect their spaces because
Absolutely.
who knows what tomorrow holds for them. And maybe they don't wake up, then you start saying, I should have done this, I should have done that. Dr. Noella, in your experience, how does breast cancer awareness contribute to better health outcomes? Does the knowledge you guys are spreading, do you think is making sense? And not only that, what are the initiatives for other strategies that people can do to promote mental health? Before we close.
The whole story has really made me so emotional. That's
It's
so touching. That's so nice. Seriously, we need to really take this really serious. Health personnel take this really, really serious because it hurts those who are diagnosed. That's really a shift in life.
Mhm.
So
Yeah.
it's really a good thing. If people can really emulate that, that would be great. So, to actually promote mental health and maybe how it has maybe the advocacy improve maternal health or in breast cancer, the first thing is with the advocacy and early screening, it has led to early diagnosis. We have maybe at least more people getting diagnosed earlier, where
Right.
maybe treatments can be put forward and they can actually be cured of the cancer, which is very, very important, and that's the aim at the end. I would just like to share a story of someone I knew about who
Right.
had cancer, not breast cancer, but she had just one child. And when she was diagnosed of this cancer, they wanted to start her on treatment immediately because it was diagnosed early. But she said no, she knows that once you start having chemo,
Yeah.
radiotherapy, it might affect maybe like the ovaries.
Yeah.
And for you to start having children might be difficult. She said, no, let her stay and try to have her kids first before coming in for treatment. And
Women and
unfortunately,
children. Women and children.
it took her up until she didn't survive and she finally had only that child. So that was a case that I really saw or heard about with the cancer case and maybe with relating it to pregnancy. So what maybe the advocacy has done again, it has helped people, especially when you go now and you check yourself and you see that you are fine. You feel comforted. You feel like, oh, that's good. I'm fine. It means I'm doing well. I'm doing well. Let me keep up with my lifestyle modifications. Let me keep up. Let me do more sports. Let me eat more of this. Let me. So it gives you that courage to
Right.
Yes.
continue doing what you were doing. So it makes you. So it still spans through with maybe general screening. If you're screening for something, once you check yourself and you see that you're fine, you feel like, oh, it means I'm doing well, keep up. Or if you were not doing well, you can say, okay, let me start. So those are like the impact of advocacy. Now it also increased knowledge,
Yeah.
and we are able to actually share it to others because just like we were saying, just one person, like now when we are talking, I think that there might be some people who must have heard about cancer, but there are still some people who might be hearing some new things today, and it might just have encouraged you. It has just has given you that strength you just needed at this moment. So just one person you touch, I always say just one woman I help, is very okay for me. I don't need so
Absolutely.
many. One
Absolutely.
woman, it's okay.
Absolutely. They normally
Yes.
say you save one, you have saved 100, and those 100
Is
can save 1,000.
1,000.
Any
Perfect.
final words, Dr. Noella? Any final
Yeah,
words
the
to the audience?
yeah, I just want to even thank you again for having us,
Oh, I'm going to
Jessica.
ask you
It's great
again.
to hear your story. I mean, it's so so touching, and I'm glad you survived this and you're able to give back to the community. And I
Absolutely.
think that is the power or the magic in all this. We can see what Denise is doing. She's giving back. And for me, what even brought me out to talk pregnancy with Dr. Noella is a complication I had to during pregnancy. And with the survive, and my baby survived myself. And I was like, if I can get this early treatment, I can get this adequate and quality care. How about those outside? How can I help them? That was when I started this. So I think that's the common thing within all of us
Absolutely.
is giving back to our community and saving other people. Thank you very much.
Absolutely. Before your final question, your final words, Miss Denise, for those who are going through treatment, what tips do you have for managing the anxiety and depression during this process?
Oh, what I have to say is stay connected with people, stay connected with your loved ones. If you have an anxiety attack, you're breathing out days, it can pass. It's very important for you to stay connected with people. Call a loved one if you're not already seeking help. Call a loved one. Just out everything. Tell them what you're experiencing right now. Share it.
Wow.
Call somebody who's not going to judge you, who's not going to make you feel like you're bothering them or anything.
Mhm.
Call them. Do what you love. See, I always say life is going to give you what to prioritize.
Amen.
And when it does, I hope that you
Yeah.
have the
Amen.
courage,
Amen.
to fix
I'll
that.
write that.
Yeah.
Life is going to give you
That's
what you prioritize. Yeah.
spot
It's
on.
Do
Yes.
what you
what you focus on is what manifests
exactly.
itself. Yeah. What you focus on is what manifests itself. Go ahead, please.
Yeah.
Mm-hmm. And even
Yeah.
I see a lot of
Seek professional help or
yeah, I see a lot of patients going through this with anxiety, depression, psycho. We always push psychotherapy, mind, body practices. Like you can hear from Jessica, meditation, yoga, it helps her because you're going to connect with yourself in a deeper level and it improves your mood while it's reducing the anxiety. And not only that, it gives you a sense of control, it fosters control because you know yourself better and you know your needs better. Seek professional help. Psychotherapy, mind body exercises, medication will help, meditation will help, community support. Your environment is there. Go seek help with nature. Do what you like to do. Get your family and caregiver support. Any last words, Miss Denise? I hope we hear you this time. Any last words? I
no,
know
I'm
you're
just going to add
so sorry.
set don't tell oh
Oh.
no.
I know, and
Oh.
Can you
we know you're saying something wonderful. We just cannot hear you. We just cannot hear you. Any final words, Jessica?
I don't
Again,
know why
thank you for
my network would choose to do this to me.
I prayed for next.
Oh.
Tell you, Jessica, I in Cameroon. I prayed. I was like, hey, network.
um, final last words would be, self advocate,
Well,
trust your gut. If you
Hmm.
feel something's wrong, seek professional
Yeah.
help and rely on your community. Ask for help. It's okay.
Wow.
I'm
yeah.
And
so
I would like to give a shout out really quick. Sorry. My mom was recently diagnosed with metastatic breast cancer. So I would like to just give a shout out to her and let her know that, I'm supportive and that she's loved. And
We
so,
love her.
if you're watching or
so
dear
much.
administrator.
Love
Our
you.
hearts, our love pour out to you and mom.
Sending love. Sending
We
Sending
love
love,
you, Mom.
Thank you so much.
sending love. We hope that you use the resources that are available. You can use All Mercy for counseling. I'm Jessica know what to do to keep you connected with All Mercy. I am here, mom. We are here. Air hugs. We cannot do physical hugs right now. We will
Yes.
be praying. Any questions, please tell Jessica. Jessica can email me. Have a lot of resources. Do what your care providers are asking you. Whew. We are here for you, not just as women, not just as Jessica's sisters, but as breast cancer supporters. We are supporting to eradicate that, and we are supporting anybody going through that journey, mom. So, Jessica, you're not alone with your mom, okay?
Yeah,
Thank you so
yeah.
much. Thank you so much.
You're not alone with your mom. It's funny how, like, Denise was saying something like, your mother can have it, then you get that scared. What if I have it? You had it before your mom. Oh,
Before your mom.
I did, yeah. Yeah, so
Wow.
I look, and I'm like, is that what my future looks like? But I can't look in those terms. This is my life and I have survived 12 years. So who's to say that I'm not going to survive another 25 or 30?
100.
Woo!
Yes.
You know,
Absolutely.
Who is to say? Oh my God.
thank you.
Yes. Yes.
Oh, thank you all so much. Thank you so much. Many organizations, such as the American Cancer Society and Breast Cancer Now, offer a lot of resources to help patients navigate the mental health effects of breast cancer journey. Addressing these mental health concerns not only improve the quality of life, but also support the overall treatment physically, emotionally, mentally, and your surrounding. They give you tips even on staying connected, because most of the time we get scared and we want to isolate ourselves. Isolation can be your grounded moments, your mindful moments, but it may easily also lead to loneliness. And you never want to feel alone in those moments. Seek help, professional,
Mm-hmm.
family, environmental. Know, get the awareness, know all your treatment options, ask a lot of questions, fight, fight, because most people lost the battle within before they lost it outside. So fight,
Outside.
build up that tenacity, build up that resilience, and know that you're never alone. Trust me, you're never alone. What is our health without our mental health? And I want to thank everyone who has been watching and commenting. Thank you all so much for being here with us.